The closer to diagnosis we become involved, the better. So sometimes we even know about, like we might have been referred someone often before diagnosis, so which is an important time actually, because that can be quite stressful, that coming up to, you know, going through the process of being diagnosed and being told the news of a cancer diagnosis. So the sooner we find out, the better, and we take referrals at whatever stage through treatment, but sort of close to diagnosis is usually when we get involved, usually. And then, as I said, we're available all through treatment, and then we haven't really officially within our service have a discharge plan, because what we find is in the paediatric hospitals they have a long-term follow-up that you can refer them back to, but that only starts sort of 5 years after treatment anyway, so there's that really in-between stage. And they've got to come back a lot for, at that point, once treatment's finished, they've still got to come back for revalue, like scans and checkups and doctor's appointments. So within that time, once treatment's finished, we still will turn up and say hi to them in the waiting room. Sometimes sit in and on consultations and stuff still at that point. Still be a contact person for them out in the community if they, and often that's the case, they ring up and say, oh, I haven't had scans for a while, when are they due, what should I be doing? So we facilitate that kind of stuff and coordinate that sort of stuff for them. Also with schools, we don't, if they're still at school, we don't sort of back off on that. If they've been in year 10 when they're diagnosed and then they're off treatment and then they're coming up to year 12, we'll still support them with letters and stuff to make sure that because it still can, you know, be having an impact on the school. They've obviously missed school, so we'll still continue to support them through that. And then I guess otherwise it's, we become sort of less involved when treatment finishes, but we're still available. And we still say to everyone, like, you know, if you've got any other issues that we're not already sort of talked about, then they can call us anytime. And we can still facilitate referrals to, you know, clinical psychology or back to social work or back to any sort of community resources out in the, yeah. And, you know, things like CanTeen and Red Kite will still refer to after that point if they weren't involved to begin with or they weren't interested then. Often we find once treatment's finished that that's when those kinds of things can be really useful.